Hi, my name is Dr. Theresa Larson, and I'm a former Marine Corps officer. I was an engineer officer between the years of 2003 and 2007. I got out, played softball for a year in Italy, and then became a physical therapist. Of course, there was education involved there, a lot of it, but I decided to open my own physical therapy clinic because what I saw out there in the PT world and the way people were being taken care of, both in the military, in the veteran administration system, and just globally, I didn't like it. I'm a veteran. I've been in part of the VA. I've been to military medicine, and it's a tough pill to swallow. Military medicine, they see 20 to 30 people a day, typically in a PT clinic. At the veteran administration, it takes time. I remember I had a couple injuries post-Marine Corps that I had to go be seen for, and it was a 3-month wait to get into physical therapy. And that's still a common story that I hear. So I started my own clinic with my husband because I wanted to treat people the way they deserve to be treated. We are a boutique, premier, cash pay clinic, but we've chosen to take TriCare and TriWest because we want to work with our military. There's a lot of military and veterans locally. That is a focus of ours. We want to give them what they deserve. We want to give people what they deserve. A premier experience where they feel taken care of, where they leave and they feel like they will never forget the way that we made them feel. Because I never had that. So the main problems that I see in the military medicine, and in the veteran administration system is time, attention to detail, and actually fixing the problem. So time, in naval medicine, Army medicine, typically a PT, even a doctor. Actually, I don't know how many patients a doctor sees a day, but a physical therapist, that people typically go to a physical therapist for musculoskeletal conditions like back pain, shoulder pain, knee pain, tendinitis, tendinosis, bursitis. They see 20 to 30 patients a day. So how much time do you think they can spend with you? 10 to 15 minutes tops, typically. And then they pass you off to someone who maybe doesn't understand the body as much as that PT. The PT went through a lot of education, but their hands are tied. They're handcuffed to seeing you for 15, maybe 20 minutes tops, and then you're handed off to someone who doesn't really understand the body the way they do. So the second thing is attention to detail. So the level of attention to detail, if you can only see someone for 15 to 20 minutes for a low back issue, a shoulder issue, a knee issue, usually it's not one thing that's going on with people. There's mental struggles too, vulnerabilities after being injured. It's hard. Low back issues often come with hip issues. It's never one thing. So their abilities, they can only focus in on that one area. Whereas that one area, that pain area, is actually not the problem. The problem is elsewhere, but they don't have the time to look at it. So that ability to fix the problem doesn't happen. So the whole, I need to see you 3 times a week for 8 to 12 weeks typically happens, but they're only working on symptoms of that one area because they only have so much time. So that's what I see and what I've experienced in military medicine. I work with commanders, I work with privates, I work with the spectrum of people who are serving in our nation's military now. And that is a very common thing. Now on the veteran side of things, time, the problem with time is that you need to be seen, but there's a waiting list. And so the ability to be seen right away for low back issues, neck issues, shoulder, knee, whatever it is, it's gonna be a while. So that issue that just happened is now going to become chronic, because a chronic condition is something that develops after 3 months of being in pain. And that's very common. There's a long waiting list. So once you get into the VA, it's the same thing as regular military medicine. VA, because there's so many people being seen at these PT clinics and there's not enough PTs to go around, they see 20 to 30 patients a day. So again, you're only being seen for 15 to 20 minutes. And if you've had an issue for a while and it's come from other areas, if your foot issue is coming from your neck or vice versa, which can happen, are they actually looking that much in depth? Are they able to look at what's beyond just that pain area? Because science shows that where the pain is isn't the problem. So here, what's the solution? So the solution is you have companies like myself, Movement RX. where we're designed to work with people and solve their problems. We know that low back pain, that's not where the problem is. The problem is elsewhere. We know that shoulder pain, we always have to look at the neck. We always have to look at the ankle. There's other things we want to look at. We want to treat someone for the entire hour. That's what we have the ability to do, is treat someone for the entire hour. Give them the time they deserve and the attention they deserve. But we also hold people accountable. Instead of seeing someone 2 or 3 times a week, depending on their situation, how independent they are, like, we want them to help fix themselves, give them tools for life versus having them rely on us and be dependent on us, because that's not an empowering model at all. The military medicine, the veteran administration system is not empowering because they're not fixing the problem. And they're creating this habit of coming back over and over again, but they're just rubbing out the symptoms. Now, with MovementRx, we can actually work on the problem, solve the problem, give people tools for life. We give them video-based home programs, even written out if that person needs to, based on their technology, their savviness with technology. But we give them what they need: time, attention, and solving the problem. So we only take TriCare and TriWest, and we're a cash pay clinic. So we hope that you guys can work with us. We love to work with you. We want to give you what you deserve.